Hi, this is Dr. Sanar. In this quick video, we will walk you through exactly what to expect after your procedure. Tips, recovery, and everything you need to heal faster and feel better. Let's make your recovery smooth and stress-free. Let's start. Within this video, we'll be talking about what are the wisdom teeth and what happens if we decide to keep them there without any extractions, what could just they cause as a threat in the long run. As the second topic, we'll be dealing with a little bit more preparation for any wisdom tooth removal and what to do, what to refrain before the procedure. Finally, we'll be talking about the procedure itself and its normal outcomes, normal expectations. As final topic, we'll be dealing with the complication risks as well. Well, the wisdom teeth are the third molars, and then normally we just see them as the last teeth in our dental arch, and we have four of them in general. Well, they are normal appearance time in the mouth is in between 17 to 25 years of age. However, if their emergence delays or doesn't happen anymore, in that case, we call these wisdom teeth, which are sleeping under the gum or under the bone, as an impacted wisdom tooth. The reasons to suggest the extraction of the impacted wisdom teeth are in general the pain and then the swelling on that side. And sometimes the wisdoms are trying to show in the mouth, but partially covered with the gum. And then sometimes we just start chewing the overlying gum, which can traumatize the area and then can cause an gum infection. And that infection can be a really disturbing condition, which we call as the pericoronitis. Another important reason why we suggest to remove the wisdoms is the pressure of an impacted wisdom tooth on the adjacent root can cause a damage and erosion on the root surface, and that can lead the extraction of the adjacent tooth. And moreover, in between the wisdom tooth and then the adjacent one, there will be a little gap which you can just keep the food inside, and when the food stuck in between two teeth, it can cause some cavities on the adjacent tooth, or there might be a big bone loss, which is going to be a gum infection in between, and that can just be a very serious infection in the long run. Normally, our teeth have a tendency to shift forward. However, the presence of an impacted teeth on the back, which will be another threat in the long run, and those wisdom teeth will be trying to show in the mouth while they're just asking some more space to show, and then they might cause an additional crowding issues on the front sides most likely. And finally, when the wisdom teeth are stuck inside the jawbone, their developmental sac, which normally fabricates the tooth, can transform into a cystic nature, and then it can just create a cystic liquid inside, and while this liquid accumulates in the cystic cavity, it will expand inside the bone. While it is growing, it will damage the adjacent structures. Likewise, this sac can just transform into a tumor and then might end up with some neoplastic activity. Because of those above mentioned reasons, we always recommend to get rid of the wisdom teeth before they just cause any further damages. So let's talk about a bit more the preparation and then the procedure and finally the postoperative period. When you decide to have your wisdoms extracted, the first you need to do is to book an appointment with your doctor. So your doctor will just make an exam inside and outside your mouth and will assess the clinical condition. X-rays are the guides of the surgeon. First of all, the dentist would like to see the relation of your wisdoms and then their positions, and also they would love to see if there's any damage risk to the adjacent teeth, or they can visualize the relation with the surrounding anatomical structures like the nerves in the lower jaw or the sinuses in the upper jaw. If there's any concern about those risky relations, maybe your doctor can just ask you to perform another imaging, which will be giving more detail and then guide the dentist in a more secure way. And then they would love to discuss more details in the upcoming session to see the CBCT report. During the consultation appointment, your doctor will explain you what the procedure is looking like and what to expect about the procedure. And finally, the complication risks will be also mentioned. And if there's a highly risky condition, then you may have a chance to discuss the alternative ways, like no treatment or if there's any alternative surgical procedure. That's why spare your questions at the end of the discussion. Another important title to talk during the consultation appointment is the anesthesia type. Normally, your doctor will administer the local anesthetics, and then you're not going to feel any pain. However, you may feel some pressure and pushing or some vibration during the procedure, but that is not going to hurt you. However, if you're feeling a little bit anxious, in that case, you may discuss the sedation options additional to the local anesthetics. It may vary from mild to moderate or deep sedations, and that's why it's better to be honest to your dentist about your anxiety level so that your doctor can just render the proper treatment. To prepare yourself for the upcoming procedure, it does make sense to come to the office with more comfortable clothes. So you don't want to sit on the dental chair with really tight outfit. And moreover, if you're going to get the sedation, depending on the type of the sedation, your doctor will give you the instructions about how to prepare yourself. The first thing first to talk is the fasting. Normally, for the laughing gas or let's say the nitrous oxide, we need to see the patients with at least 2 hours fasting before the procedure. And fasting means nothing to eat, nothing to drink, even a sip of water, chewing gum or even candy is not permitted. But if you have to take your medications before the procedure, then you can take the medications 2 hours prior to the procedure with a sip of water, but not more than that. And for the general anesthesia or IV mode of sedation, you need to bring an adult person with you who is going to be responsible to drop you to the office and to pick you up when the procedure is done. But in that case, keep in mind that the fasting time will be 8 hours before the procedure, which is a mandatory legal requirement. And at the same time, it's better to remove all the nail polishing or artificial nails just to make the readings easier for you. As a result, your doctor will summarize the pre-operative instructions about how to prepare yourself for the upcoming procedure, and then will also deal with the normal expectations which will happen after the procedure, and finally deal with the post-operative instructions as well. In general speaking, after any tooth removal, for the first couple days, it's normal to have some pain and bleeding and some soreness on the extraction side. Even after a baby tooth extraction, those are normal findings. And then the bleeding should be not more than an oozing. Therefore, please listen to the instructions carefully and then prepare your mindset accordingly. And having some swelling on the face and some bruises on the skin are also normal expectations. When you wake up with a big swollen purple face next day, don't worry about that. Even if it happens, it will disappear in 1 week, which is your recovery time. Pain is a normal expectation after any surgical procedure. That's why you will need your painkillers when the freezing effect is gone. With this regard, keep in mind it's a good way to take your painkillers right away at the pharmacy before the freezing dissolves. And for the pain management and also the swelling and bruising control, ice bag use is a very important and effective way. So with this regard, keep in mind that you just need to apply the ice on the extraction site like 50 minutes on and 50 minutes off. Even if you don't have any ice, you may apply some pressure with your palm. The pressure will also help to stop the bleeding and also minimize the edema. After the procedure, to avoid any excessive bleeding, you should bite your gauze at least half an hour or 45 minutes, and please do not change the gauze very often. And you should avoid spitting out, brushing your teeth, or making a rinse for 24 hours. And do not use any straw to drink any fluid, and try to avoid any excessive physical activity. Besides the gauze compression, ice, and then resting, it's also important to elevate the head position during the night time so that the blood flow to the head will be diminished and then the bleeding risk will be also minimized. And for the same day and then the next day, ice popsicles or ice cream could be the best because they are really soft and cold, which will help to reduce the bleeding chance. Going with a soft toothbrush for the first couple days will minimize the irritation on the side. And unless your dentist prescribes you any specific mouthwash, you can go with 3 to 4 times a day salt water rinse with a gentle rinsing can help to reduce the inflammation and reduce the infection risk as well. Having some persistent severe pain, fever, or major swelling, it could be a red flag for a possible infection. That's why you should call your dentist as soon as possible. Sometimes all these symptoms can happen after the regular healing period. Late extraction site infections are most likely related with the lack of oral hygiene practice. Especially for the lower jaw extractions, the patients receive a syringe which should be used after any meal so that all the food particles which will precipitate into the extraction socket can be eliminated by means of this syringe. And ask your doctor about how long you need to use the syringe so that you can get the proper instructions according to your surgical procedure. Dry socket is another nightmare as a complication risk after the tooth extractions, and the smokers have a higher tendency to get this complication risk. Normally, the extraction socket will be filled with the blood clot after the extraction. The blood clot is the healing tissue. But if the clot is disturbed and then dislodged from the socket, the naked bony walls will be exposed into the mouth and it will be very sensitive and painful. This is the condition which we call as the dry socket. Another major risk after the lower wisdom tooth extractions is the nerve damage risk. Normally, there is a canal running inside our jawbone, and that canal carries a nerve inside. And that nerve is responsible to get the sensation of our lower lip from corner to our mouth and up to the midline and up to the chin, and all the skin area and all the bottom teeth is innervated by this nerve. And when we just get a section from this area and then assume that we are looking at this area from the side, the cross-sectional view of our lower jaw will be like that. And let's assume that we have the nerve canal inside the jawbone. In the third dimension, the roots of the impacted wisdom tooth could be in front or inside the canal or behind the canal. All these three locations will be giving the same appearance on the X-ray. And then that's why we cannot say that the roots are literally related with the nerve. With this regard, your doctor may suggest you to get more detailed images with a CBCT that can give a better idea about the three-dimensional relation with the nerve and then the root tips. For the upper jaw extractions, we can deal with another complication risk which we call as the sinus opening. On the upper jaw, there's a big air bubble which we call as the maxillary sinus, and we can see here the border of the sinus with this fine white line. And at the same time, you can visualize that the root of this tooth is intruding this white line. And assuming that the roots are going inside the sinus, or it's periapical, or let's say the infection around the root tip, if it is related with the sinus, when the tooth is extracted, there might be an opening, a hole going into the sinus. In that case, your dentist might need to repair this opening with an additional surgical procedure and might need to follow you up for a while. The final complication risk is the jaw fracture, which normally occurs after any traffic accidents or any kind of hit accidents, but after the tooth extraction, it is a really unlikely chance to have such a kind of traumatic injury, but in a very rare chance, it might happen. Your dentist can give you more information about this possibility. For most of the patients, the bleeding could be a nightmare, but if you just bite your gauze regularly as described, the major brisk bleeding is a very low chance. Brisk bleeding might happen in a very rare occasions. If it happens, you should bite your gauze at least half an hour or 45 minutes and do not change the gauze very often, and do not spit out. And finally, get in touch with your dentist. If the office is closed, it makes sense to head to the emergency room right away. For the extended difficulty of mouth opening, your non-steroid anti-inflammatory medications will help to reduce this chance. But moreover, applying some warm compress after 36 hours the procedure and then making some mouth opening exercises will help to reduce this risk. But if it's a persistent restriction, it does make sense to call your dentist as soon as possible because it might be related with an infection. In general speaking, if you take your medications and follow the instructions, and if anything happens, if you communicate with your dentist, you'll be safe. Don't worry, you'll be in good hands. Take care. Thank you for watching this video. If you like the content, click the like button and subscribe our channel. Thanks again. See you in the next video. Bye.